More than 4 million infants die each year worldwide. Approximately 2/3 of infant deaths occur during the first month of life, making the first days of a child's life critical to its survival and future health. If the baby is born in a rural area, they're twice as likely to die. Neonatal and maternal mortality in rural communities is higher than the national average. So how can we make sure that the mother and child are both alive and healthy? This is a problem that Save the Children Uganda is tackling in Bundibujo district, Rwenzori Maternal and Newborn Access project called Baby Cup.
The project is relevant because we always do an analysis of the situation, the child rights situation, before we even start the project. And the reason why we engaged in this project was because the situation in the district, in Bundibujo, was very poor when it comes to maternal and newborn child health. For example, in every 1,000 children born alive, we had a newborn death ratio of 54 children, compared to, for example, the national average at the time, which was standing at 40. This was a health survey in 2011.
I can quote the time the project started, the deliveries, health facility deliveries were at 32%. But as we speak now, we have gone up to 69%, which is something good. Indicators like postnatal care was as low as 18%, but now we are at 96%. So I would think that the project has gone a long way in achieving its objectives.
This is the story of the Baby Cup project. Babies whose mothers have died during childbirth have a greater chance of dying in their first year than those whose mothers remain alive. Gikyo Health Center 4. The health center got an equipped operating theater funded with support from GS Shop and Save the Children. The health center has now a fully functional main operation theater.
We used to have few deliveries at the facility, almost like 20, but from the time Baby Cup project started, at least it has doubled. So in a quarter we used to deliver like 60 mothers, but now we are delivering like more than 100 mothers.
Gikyo Health Center 4 started providing cesarean sections in June of 2017, and by the end of December 2017, 27 mothers with obstetric complications could receive the service. Bundibujo district has registered a 42% reduction in institutional maternal mortality ratio from 239 to 139 maternal deaths per 100,000 health facility deliveries in 2014-2015 and 2016-2017 financial years respectively.
Gone are those days when a mother comes to hospital with a pregnancy and then either the mother dies or the baby is lost. Obvious that since they began with us, since we began getting involved with Save the Children, we've really seen a tremendous decrease in the number of mothers getting sick or possibly dying from pregnancy-related conditions, as well as the children they deliver. At least you can be sure that a mother will deliver a baby and that baby will survive.
Infrastructure improvement from other health centers has meant that there are very few cases referred from those other hospitals to Bundibujo Hospital. In Nyahoka Health Center 4, the mountainous nature of the district makes it difficult to access health facilities, and so there was a lot of delays in bringing mothers to the health center. Those delays have been shortened because of the introduction of tricycle ambulances which link mothers from lower health units to Health Center 4s. The other causes of deaths in Nyahoka Health Center 4 are power-related.
Electricity comes and goes, no breathing, no life. When we presented this proposal to Save the Children, they responded.
Through the Baby Cup project, Save the Children provided a solar system which has also reduced the cost of electricity for the health center. As a result of all these developments, the attendance of mothers has improved, attitude has changed, service delivery has improved, work tools have been provided including stationery and transport refunds. In Kisuba Health Center 3, the number of mothers delivering from the health center has increased from a quarterly average of 10 deliveries in 2015 to about 90 deliveries in a quarter by the end of 2017. The referral system here is effective, working together with VHTs and using the ambulances.
Okubanja ndi VHT de Mugisha Gorongi. Luminatura nava Raida batura bankoma kubanga Raida kuyamba abantu.
Kasuba Village Ambulance alone has transported 81 emergency cases to different health centers, most of whom are pregnant mothers and newborns with complications.
In the past, we lost very many pregnant mothers and newborn because of ignorance. Mothers, especially the TBAs, were conducting deliveries at household level. Pregnant mothers would not even mind to come and attend for antenatal care as early as she has lost a menstrual cycle.
A total of 20,827 malaria cases, 12,284 diarrhea cases, and 5,167 fast-breathing pneumonia cases among children below 5 years have been treated by VHTs under the Integrated Community Case Management Intervention. In 2017 alone, a total of 5,785 children under 5 years were referred by VHTs to different health facilities for further management. Under Baby Cup, the outpatient department building in this health center was on the verge of collapsing, but it was also built afresh. 77% of mothers with children below 5 years who were interviewed at N-Line indicated having delivered from health facilities compared to only 32% at Baseline. This is Bukangama Health Center 3. Here, Save the Children has built a maternity waiting home and a latrine block. Olive, an expectant mother, is at peace knowing that she will deliver in a hospital.
Bakondo marumerwa yewuru esarewa ikahanu wahikaho okiwangana sinde komana bitu mwana wao ni avelo bitu hungala hanu sehemu ngangana rumerwa hungaburu mwana wao.
Ntandi Health Center now has a staff house, a kitchen, attendance shed, plus a latrine for nurses on duty, such that there is always a person to attend to pregnant women. A total of 7,284 mothers have received mama kits from the different health facilities in this region. The general ward has also been renovated thanks to the efforts of Baby Cup.
Chama vitu wa teacher ngaba viri tukatukaenda tukatuke maternity tunatavye pichika tu watikaya chekatwa mama kiti vendu vinene.
This is Bambu Jonas, who was delivered from Buhinga Hospital, where her mother was referred because the baby was in breech position. Bambu is now 3 years old.
Omwana ni Bambu Jonas na mbutire Buhinga banyitsendakayo munara mererwa hana bamya bamanyitsendakayo na mabashirayo twese twafunga buwati cyobosi obanga bukatuwatikaya nembalangara mangathola naenda hana nhungana ngawati hubende banyiwatikira.
Bambu Jonas is a shining example of what Baby Cup project has achieved. Other leaders are unsure about the continuity of what has been established. They plead for a program extension.
Projects come and go, but this project touches people's lives. And for us as leadership, we would request the Save the Children to extend this project because it has done wonders.
Most credit goes out to Save the Children's field staff that throughout the years of the project have really tremendously worked very hard to implement these different projects, and also to go to the community members who are part of the project and their activities, to the village health workers, to the health service providers. Because the people out there, and they have really made the difference. They were willing to learn, willing for their capacities to be built together with the input that they've received. As well, of course, as the district actors who now need to ensure that the results are being continued. So really, I would like to thank everybody that helped Save the Children to achieve these wonderful results and that helped to ensure that more babies are alive now than they were before, that mothers are in a better conditions, and that children can grow up more healthily and don't die from unnecessary causes.